Okay. Good afternoon. Yes.
Good afternoon.
Okay. So how are you today?
I'm good, fine.
Yeah,
Okay.
fine.
Today we are going to our class is on Partograph. Okay. So before we start, I think we should just revise back what have you learned before. Okay. So can anybody tell me what do you think the meaning of Partograph by looking just at the word?
It is about a chart to assess the progress of labor.
Okay, why do you say so? I think, of course, you have read about Partograph before, but by looking at the Partograph, do you think people can understand what it is? What is the meaning of Parto? Anybody have any idea? No.
No.
Oh, just guess.
Labor.
Yeah, it's
Labor.
labor because as is mentioned, it's a chart to monitor the labor. So must be the labor from one of the words. So actually, it's a Spanish and Greek and also Italian words of parto mean labor. So parturian is also an English word. Is a pregnant lady or a laboring lady, lady who are now in labor process. So partogram, as the name is, the graph or something diagram picture to regarding the parto, regarding the labor process. Okay, so now I think we should go back to what we have learned before. What how is the mechanism of normal labor? Anybody? I have I have present. Okay. For those who can answer. Okay.
Okay, so first
And
we
this one?
have engagement of the fetal part, presented part into the pelvic inlet. Second, when engaged, the
Okay.
head
Can you
will
show
descend.
the back model?
The head will descend. Okay, the head will
Okay,
descend.
so first descend. Alright. Good.
So and then after the descendant of the head, and it will do internal rotation. So internal rotation of the head.
Okay.
And then after internal rotation, the hip will extend. Will extend when it's go down to the narrowest part of the pelvic inlet. So after that, it will do external rotation. So that the anterior shoulder will face the symphysis pubis here.
Okay.
Okay. So after that, the expulsion of the anterior shoulder. After expulsion of the anterior shoulder, then the posterior shoulder and the rest of the fetal part.
Okay, good, Mansura. Thank you. So this is a gestational age calculator, but it has some notes on this one on prolonged pregnancy. So I have some more for other questions. Okay, so we understand the normal labor. So why we want to monitor? One of the reason is we want to see if there is any normal deviation from the normal. So can anybody tell me about what are the types or what are the diagnosis or types of abnormal labor that you know?
Me, doctor.
Okay.
We have 3 types. The
Okay.
first type of abnormal labor is prolonged latent phase of labor.
Okay.
The second one will be primary dysfunctional labor. Then the third one will be the secondary arrest.
Okay. So in what stage of labor that all the 3
Active phase of labor.
active phase?
Only
What
for
stage?
except for the
What stage
first
of the labor? In the first stage. Any abnormality in the second stage that you know?
Yes.
Like?
Arrest. Secondary. Prolonged secondary.
Okay. Prolonged second stage or arrest in the second stage. Okay, good.
Okay,
So
thank you,
this
doctor.
is on chronic hypertension in pregnancy. Okay, I have another one, but I think I skip it to the to the best answer in the end of the session. So I have some quiz for you at the end. Okay, so obstructed labor. Just have to bring some of the interesting picture over here. If you see this, okay, this is a picture, real picture, okay, during the surgery. So you can see one tube over here is actually a cannula or a tube inserted into the urinary bladder. But you can see it is coming out to the vagina. So this is vesico-vagina fistula. Is one of previously some maybe 50, 60 years ago. It's very common to have obstetric fistula due to the obstructed labor. woman in labor for 24 hours, some for 2-3 days, okay, without monitoring. So obstructed labor occur, and as the result, because of the impact of the head of the baby to the adjacent organ, to the bladder, to the rectum, okay, necrosis, loss of blood supply, it cause injury. So the injury will heal as a fistula. But nowadays it's considered like a very, what do we call, a very neglected labor. Or if it is happen actually in the area, in some area it's common, the area actually is the underdeveloped, the neglected area, some like some part of Africa. So we don't see it anymore in recent years. Why is it? Because of the, this is the importance. I want to show you the importance of our topic today, which is partograph. Because of the partograph, we see the reduction in the problem, abnormal, prolonged labor, perinatal mortality, caesarean section rate, and also the rate of complication of fistula because of obstructed labor had reduced after we introduced, WHO actually introduced partograph. Okay, so I think before we start, as I told you before, I think I have messaged to you all that you should have a prior